Right now, as you're watching this, something may be happening inside your body that you cannot feel, cannot see, and may not even suspect. It doesn't cause pain, it doesn't give you a warning sign, and yet it could be quietly wearing down your heart, your kidneys, your brain, and even your eyesight, one heartbeat at a time. I'm talking about high blood pressure. And before you say, I already know about blood pressure, let me tell you something that might change the way you think about it entirely. More than 7 out of 10 adults over the age of 60 in the United States have high blood pressure right now, 7 out of 10. But here's the part that should genuinely concern you. Nearly half the people walking around with high blood pressure don't even know they have it. They feel fine. They go about their day. They sleep at night thinking everything is normal. But inside their arteries, damage is building, silently, steadily, day after day. That's why doctors call it the silent killer, not because it's rare, because it's invisible. And in my experience, that invisibility is what makes it so dangerous. People take action when something hurts. They see a doctor when something swells or bleeds or aches, but high blood pressure doesn't do any of that. It just works quietly in the background, remodeling your body from the inside out. And today, I want to take you inside your own body and show you exactly what high blood pressure is doing when nobody's watching. I'll walk you through the 5 areas where it causes the most hidden harm. And more importantly, I'll share practical steps, things you can actually do starting today to slow down and in some cases even help reverse this damage. Stay with me through this entire video because toward the end, I'm going to explain one specific change that research shows may lower your blood pressure by as much as some medications. And most people have never even heard of it. Let's start with something most people misunderstand about blood pressure after 50. Many folks assume that if they feel okay, their blood pressure must be fine. That's one of the most dangerous assumptions in medicine, because here's what's really happening. Every time your heart beats, it pushes blood through your arteries. That's normal. That's how your body delivers oxygen and nutrients to every organ. But when the pressure of that blood flowing through your arteries stays too high for too long, it starts to damage the walls of those blood vessels. Think of it like a garden hose. If you turn the pressure up just a little too high, day after day, week after week, eventually the hose starts to weaken. Tiny cracks appear. The rubber loses its flexibility, and one day that hose either bursts or can barely push water through at all. That's essentially what's happening to your arteries. And here's where things get more concerning. As we age, especially after 50, our arteries naturally begin to stiffen. They lose some of the elasticity they had when we were younger. Research shows that this stiffening, combined with high blood pressure, creates a harmful cycle. The stiffer your arteries get, the harder your heart has to push. And the harder your heart pushes, the more pressure builds, which causes even more stiffness. It feeds on itself. And unless something interrupts that cycle, the damage just keeps compounding year after year. Here's something else worth knowing. Only about 1 in 5 adults who have high blood pressure actually have it under control. That means the vast majority of people with this condition, even those who are aware of it, even some who are taking medication, are still walking around with readings that are quietly damaging their organs. That's a staggering number when you think about it. Now, most people think about blood pressure in terms of heart attacks and strokes. And yes, those are serious risks, but the damage goes far deeper than most realize. Let me walk you through the 5 places inside your body where high blood pressure is doing harm long before you ever feel a symptom. The first place is your arteries themselves. This might sound obvious, but it's the foundation of everything else. When blood pushes against your artery walls with too much force over time, it creates tiny injuries in the lining of those blood vessels. Your body tries to repair those injuries, but the repairs leave behind scar tissue. And over time, that scar tissue attracts fatty deposits. Those deposits build up, thicken, and slowly narrow the inside of your arteries. Doctors call this atherosclerosis, basically a hardening and narrowing of the arteries. Picture a hallway in your house. Now imagine the walls of that hallway slowly getting thicker and thicker year after year. Eventually, you can barely squeeze through. That's what's happening inside your blood vessels. Less blood gets through, less oxygen reaches your organs, and the damage starts spreading everywhere else. But here's what makes this so sneaky. You don't feel your arteries narrowing. There's no alarm bell. By the time someone actually notices something, maybe chest tightness, maybe shortness of breath, the damage has often been building for years, sometimes decades. Which brings me to the second area of silent damage, your heart. When your arteries are stiff and narrow, your heart has to work much harder to push blood through. Imagine trying to blow air through a straw that's half the size of a normal one. You'd have to blow much harder just to get the same amount of air through. That's what your heart does every single beat when your blood pressure stays elevated. Over time, this extra workload causes the muscular wall of your heart, especially the left side, which does most of the heavy pumping, to grow thicker. That might sound like it would make your heart stronger, but it actually does the opposite. A thicker heart wall becomes stiffer, less flexible, it can't fill with blood as efficiently, and eventually it struggles to pump enough blood to meet your body's needs. Research suggests that uncontrolled high blood pressure may double your risk of heart failure, not a heart attack, heart failure. That's when your heart can no longer pump blood effectively enough to support your body's basic functions. And many people don't realize they're heading toward heart failure until they start feeling tired all the time, short of breath during simple activities, or noticing swelling in their legs and ankles. I had a viewer write to me once. Her name was Diane. She was 67 years old, still active, still gardening every weekend. She said she felt perfectly fine, but during a routine check, her doctor found that her blood pressure had been running high, probably for years. An ultrasound of her heart showed thickening of the left ventricle. Her heart had been silently overworking for so long that it had started to change shape. Diane's story isn't unusual, it's incredibly common, and that's what concerns me most about this condition. The people who are most at risk often feel the least worried because their body isn't telling them anything is wrong. But inside, the story is very different. Have you ever had your blood pressure checked and been told it was a little high, but nobody seemed too concerned? I'd love to hear about that in the comments, because sometimes those a little high readings are the ones that deserve the most attention. Now, let me show you the third area of damage that most people never even think about: your kidneys. Your kidneys are like two incredible filters sitting in your lower back. Every day, they process roughly 50 gallons of blood. They pull out waste, balance your fluids, and help control, interestingly, your blood pressure itself. But to do all of that, your kidneys rely on a network of extremely tiny, delicate blood vessels. When blood pressure stays elevated, those tiny vessels inside your kidneys take a beating. They narrow, they harden, they lose their ability to filter properly. And here's the cruel part: when your kidneys get damaged, they become less effective at helping regulate blood pressure. So your blood pressure goes up even more, which damages your kidneys even further. It's another vicious cycle. High blood pressure is one of the leading causes of kidney failure in the United States, and in many cases, people don't realize their kidneys are struggling until the damage is quite advanced. That's because your kidneys are remarkably good at compensating. They can lose a significant amount of their function before you notice anything at all. Maybe a little extra fatigue, maybe slightly more trips to the bathroom at night, but nothing that screams emergency. By the time kidney damage becomes obvious, the options for treatment become more limited. And in the most serious cases, the conversation turns to dialysis, a process where a machine has to do the filtering your kidneys can no longer handle on their own. I don't say that to frighten you. I say it because this is largely preventable. Catching and managing blood pressure early is one of the most powerful things you can do to protect your kidneys for the long haul. And if you already have diabetes, which many people over 50 do, the risk is even greater. Diabetes and high blood pressure together are particularly hard on the kidneys. Each one magnifies the damage the other causes. So if both of those numbers are higher than they should be, protecting your kidneys becomes even more urgent. Now, the fourth area of hidden damage surprised a lot of people when I first started talking about it: your brain. Most of us think of the brain as separate from blood pressure, but your brain depends on a constant, steady flow of blood to function. It needs oxygen and glucose every second, and it gets those things through a vast network of blood vessels, some of the smallest in your entire body. When blood pressure stays high over time, it damages those small vessels in the brain. Blood flow becomes less efficient. Some areas of the brain may not get the oxygen they need, and over time, this can lead to something doctors call small vessel disease, tiny areas of damage deep inside the brain that don't cause a sudden stroke but slowly chip away at cognitive function. Research published in multiple studies has linked midlife high blood pressure to an increased risk of cognitive decline later in life. That includes problems with memory, processing speed, attention, and decision making. Some research has also connected long-term uncontrolled hypertension to a higher risk of developing dementia. In fact, the World Health Organization has listed hypertension as a leading cause of dementia alongside heart attack, stroke, and kidney disease. Think of it this way: your brain is like a filing cabinet. Every day, you store new information. You retrieve old memories. You make sense of the world around you. But if the delivery trucks that bring supplies to the filing room start arriving late or don't arrive at all, things start to fall behind, papers get lost, organization breaks down, and after enough time, the whole system begins to struggle. That's what reduced blood flow does to the brain, slowly quietly, over years. Now, I want to be balanced here. The relationship between blood pressure and dementia is still being studied, and the picture in older adults is more complex than in middle-aged adults. Some research even suggests that in very old adults, those in their late 80s and 90s, the relationship may look different. But the overall body of evidence is clear enough that controlling blood pressure, particularly during your 50s, 60s, and 70s, is considered one of the most important modifiable steps you can take to protect your brain long term. Harold was 72 when his daughter noticed he was repeating stories he'd just told her 10 minutes earlier. He laughed it off. But when his doctor checked his blood pressure, which he hadn't checked in over 2 years, it was significantly elevated. An MRI showed early signs of small vessel damage in his brain. Harold's forgetfulness wasn't just aging, it was partially a consequence of blood pressure that had been too high for too long. And that brings me to the fifth area of silent damage, one that often shocks people: your eyes. Your eyes contain some of the tiniest blood vessels in your body, and because they're so small, they're among the first to show damage from high blood pressure. When the pressure stays elevated, these tiny vessels in the back of your eye, in the retina, can swell, leak, or even burst. Doctors call this hypertensive retinopathy. In the early stages, you might not notice anything, but over time it can lead to blurred vision, dark spots, or even permanent vision loss in severe cases. High blood pressure has also been associated with an increased risk of glaucoma, a condition where pressure builds inside the eye itself and can damage the optic nerve. What's interesting is that an eye exam can sometimes reveal blood pressure damage before other tests do. Your eye doctor can actually see the condition of those tiny blood vessels just by looking into your eyes. It's like a window into what's happening throughout your entire cardiovascular system. So now you've seen the 5 places where high blood pressure does its damage silently: your arteries, your heart, your kidneys, your brain, and your eyes. 5 organs, 5 targets, all being affected without you feeling a thing. That's the sobering reality. But if you're still watching, and I'm glad you are, it tells me something important about you. It tells me you're the kind of person who wants to take charge of your health rather than just hope for the best. And that matters more than you might realize, because here's the hopeful part: this damage doesn't have to keep progressing. Research consistently shows that managing your blood pressure, even later in life, can slow down and in some cases help reverse some of this damage. And you don't necessarily need to make dramatic changes overnight. Small, consistent steps can make a meaningful difference. Let me share a few of the most evidence-supported actions you can take. The first one is beautifully simple: walk more. I know that sounds too easy, but a study published in the Journal of Cardiovascular Development and Disease looked at sedentary older adults with high blood pressure, people in their late 60s and 70s who were averaging only about 4,000 steps a day. The researchers asked them to add just 3,000 more steps per day. That's roughly a 25 to 30-minute walk. After 20 weeks, both their systolic and diastolic blood pressure improved significantly. On average, systolic pressure dropped by about 7 points and diastolic dropped by about 4. Those are numbers that rival some medications. And it didn't require a gym membership. It didn't require expensive equipment, just walking consistently. Margaret was 71 and hadn't exercised regularly in years. Her knees bothered her. She figured her walking days were behind her. But after her doctor told her about blood pressure concerns, she decided to try something small. She started walking to her mailbox and back 3 times a day. That was it. Then she gradually started walking around the block. Within a few months, her readings started to improve. Nothing dramatic at first, but steady. Her doctor was pleasantly surprised, and Margaret felt a sense of control over her own health that she hadn't felt in years. That's the key. Consistency matters more than intensity. You don't need to run. You don't need to push through pain. You just need to move a little more than you did yesterday, and keep doing it. The second action involves what you eat, and this is where something called the DASH eating pattern comes in. DASH stands for Dietary Approaches to Stop Hypertension. It's not a fad diet. It's an eating pattern that was developed specifically through clinical research to help lower blood pressure. It focuses on eating more fruits, vegetables, whole grains, and low-fat dairy while reducing saturated fat and sodium. Clinical trials have shown that following the DASH pattern can lower systolic blood pressure by an average of 5 to 11 points, depending on where your blood pressure started. When you combine it with reducing sodium intake, the results become even more impressive. Here's what I find remarkable. In one landmark trial, participants who followed the DASH pattern and also lowered their sodium intake saw systolic blood pressure reductions of about 11 points on average compared to those eating a typical American diet with higher sodium. For some people, that's the equivalent of adding a blood pressure medication just through food choices. And you don't have to change everything at once. Start by adding one extra serving of vegetables to your dinner, swap a salty snack for a piece of fruit, choose herbs and spices instead of reaching for the salt shaker. Small swaps. Over time, they add up. The third action is one people often overlook. Pay attention to potassium. Most of the conversation around blood pressure focuses on sodium, how much salt you're eating, and that's important. But potassium plays the other side of the equation. Potassium helps your body balance the effects of sodium, it helps your blood vessels relax, and research suggests that getting enough potassium in your diet is associated with lower blood pressure, particularly in people who already have hypertension. Foods rich in potassium include bananas, sweet potatoes, spinach, beans, avocados, and tomatoes. Many people aren't getting nearly enough, not because these foods are hard to find, but simply because they haven't been on the radar. Now, I want to be careful here. If you have kidney concerns or you're taking certain medications, you should absolutely talk with your doctor before increasing potassium significantly. That's important. But for most people, getting more potassium from real whole foods is a sensible step toward better blood pressure. The fourth action is monitoring, simply knowing your numbers. Remember, high blood pressure doesn't announce itself. It doesn't make you dizzy until it's dangerously high. It doesn't give you headaches in most cases. The only way to know where you stand is to check it. A home blood pressure monitor can be one of the most valuable health tools you own. They're inexpensive, they're easy to use, and they give you data that you and your doctor can use to make better decisions about your health. I recommend checking your blood pressure at the same time each day, sitting quietly for 5 minutes first. Track the numbers, look for patterns. If your readings are consistently above 130/80, that's a conversation worth having with your doctor sooner rather than later. The 2025 guidelines from the American Heart Association and American College of Cardiology continue to define hypertension at 130/80 and emphasize earlier treatment, especially for people with other risk factors like diabetes or kidney concerns. And the fifth action is perhaps the most overlooked of all: manage your stress. Chronic stress doesn't just make you feel tense, it triggers hormonal responses in your body that raise blood pressure. Cortisol, adrenaline, these stress hormones narrow your blood vessels and make your heart beat faster. If that happens once in a while, your body handles it. But when stress becomes constant, from worry, from poor sleep, from caregiving, from financial pressure, it keeps your blood pressure elevated far more than most people realize. Even simple practices can help. Slow, deep breathing for 5 minutes, a short walk outside, spending time with someone who makes you laugh, listening to music that relaxes you. These aren't luxuries, they're tools for your health. Now, before I wrap up, I want to come back to something I said earlier about why this matters so much after 50. When you're young, your arteries are soft and flexible. They stretch with each heartbeat and then bounce back. They absorb the pressure naturally. But after 50, that flexibility starts to decline. The elastic fibers in your artery walls begin to break down. Collagen builds up. The arteries stiffen. And when you combine that natural stiffening with blood pressure that's even a little too high, the damage accelerates. It's not one or the other, it's both together. Age makes you more vulnerable. High blood pressure takes advantage of that vulnerability. That's not meant to discourage you, it's meant to motivate you, because the earlier you take action, even small action, the more you can protect yourself. Studies show that lifestyle changes like walking, eating more fruits and vegetables, reducing sodium, and managing stress can make a real measurable difference in blood pressure. For some people, these changes are enough on their own. For others, they work alongside medication to provide better control than medication alone. The point is, you're not powerless here, far from it. So let me leave you with a few simple steps you can take, starting today. First, check your blood pressure this week. If you don't have a home monitor, most pharmacies have one available. Know your numbers. Second, add a short walk to your daily routine. Even 15 or 20 minutes makes a difference. Third, look at what's on your plate tonight. Can you add one vegetable? Can you use a little less salt and a little more flavor from herbs? Fourth, take 5 minutes today to sit quietly and breathe slowly, just 5 minutes. And fifth, if you haven't spoken to your doctor about your blood pressure in the past year, make that appointment. Don't wait for symptoms, because as we've talked about today, symptoms are often the last thing to appear. I hope today's video helped you understand what's really happening inside your body when blood pressure stays too high. This isn't about fear, it's about awareness. It's about knowing what you can do and choosing to do it. Now, we've covered a lot today about blood pressure, but there's another number that millions of people over 50 aren't watching closely enough, a number that's just as silent, just as damaging, and just as important, and it has to do with your blood sugar. That's exactly what I'll explain in the next video. I think you'll find it just as eye-opening as what we talked about today. Thank you for watching. If this helped you, take a moment to share it with someone you care about. Sometimes the most important health information is the kind nobody thinks to look for. I'll see you in the next one.